the basal body temperature, which is the BBT, the basal body temperature. Now, the basal body temperature basically is the temperature. It's about you measuring the temperature on a daily basis, having to check your temperature. And the most recommended temperatures here would either be an oral temperature, a vaginal or a rectal temperature, and not the temporal or the frontal and axillary temperatures. Those may not necessarily give you the most accurate and consistent reading. So you would want to use either the oral, the rectal, or the vaginal temperature readings for you to have a more accurate reading of what your basal body temperature would be. So this basal body temperature is the temperature reading that you're obviously going to get at waking up. That is when you have been resting for at least a period of about 3 hours, and not less than 3 hours, because what is then going to be happening is that progesterone is going to then cause a raise in the body temperature. So you want to know what the body temperature is going to be when you have been resting for a period of about 3 hours, and before waking up, then you take your body temperature on a daily basis. So once you denote and note the temperature readings for that particular month, so you'll be doing this on a daily basis. And that's why we're saying that the natural family planning methods or fertility awareness methods, they need you to be very disciplined and committed, because you have to do this on a daily basis. And if you are doing this, then you note that your temperature readings are of a certain value. Let's take, for instance, 36.5 degrees Celsius. And then when you get to a stage where you then ovulate, there will be plenty of progesterone that is coming into play. And so that coming into a high amounts of progesterone then raises your temperature. And when it raises your temperature, it means that your temperature is going to be high until your next menstrual period. So it means that progesterone is going to be in higher amounts until a time when you have your next menses. So the basal body temperature method is going to help you to determine periods or fertile periods retrospectively. You may not use it as a one-time method, so you will need to do this on a couple of times for you to then understand when you had a rise in temperature. So if you've been checking your temperature for the first 13 days, and then on day 14 you then ovulate and you check your temperature, you notice that the temperature has started going higher. And if your temperature has started going higher, it may increase from about 0.2 to 0.5 degrees Celsius. So that increment in the temperature is indicating that you are in your fertile period. So all you're going to do is, after you have finished that entire cycle, so 6 days prior to the time of ovulation and about 2 to 3 days after ovulation, those will be the days that will be considered as your fertile days. It means that if sexual intercourse is allowed to happen around that period, then the chances of you getting pregnant are obviously going to be high. So this method is going to help you to understand when you are